By virtue of the authority entrusted to me, I hereby constitute this assembly as a legal congregation of the University of Pretoria. During this assembly, degrees and diplomas with all the associated rights and privileges will be conferred and awarded to the candidates whose names are in the program. Please take a seat. Ladies and gentlemen, we request you to join us in a silent prayer of meditation to give thanks for the achievements of our students today. Thank you. Good afternoon, ladies and gentlemen, and welcome to this autumn graduation ceremony in the Faculty of Health Sciences. And it is indeed a great pleasure for me to officiate this auspicious event where 391 degrees will be conferred and 4 certificates will be awarded. This, of course, includes 14 PhDs, 100 master's degrees, and 277 MBCHB degrees. I wish to convey the congratulations of our Chancellor and Vice Chancellor and all our executive team members to the graduating class, and of course the Dean and Deputy Deans of the Faculty of Health Sciences are truly enthralled by your remarkable achievement, and I convey their heartfelt congratulations to you and your families for achieving this milestone. Of course, you had a long journey with them in the faculty, with at least a minimum of 6 years and above, and they are truly happy to see you here today. Ladies and gentlemen, a few weeks ago, at a ceremony to honor the top matriculants of 2018, our Vice Chancellor, Professor Tawana Kupe, said, UP believes in nurturing the best young, fine minds so that their full potential is realized, and that developing the potential of excellent students will enable them to transform their lives, a society and a continent, so that it is economically developed and socially progressive. And many of the top achievers present at this event are currently enrolled in your faculty. And likewise, many of the graduates to be kept at this graduation ceremony today are among the top matriculants of 2012, and all of you are indeed ranked among the best young, fine minds in this country. And indeed, you have come a long way, and today is the day in which we celebrate you as graduates. Every good that is worth possessing must be paid for in strokes of daily effort. I'd like to repeat this. This is a quote from William James, a philosopher. He's not a medical practitioner. He says, every good that is worth possessing must be paid for in strokes of daily effort. And that is indeed what you have done, strokes of daily effort. The degree you receive today will certainly, take you far, and it is worth it. And in celebrating your achievement, it is fitting that we should also give recognition to all the people who have supported you during your studies, whether financially or academically or emotionally or otherwise. And I would therefore like you to join me in giving A round of applause to your supervisors, lecturers, mentors, tutors, librarians, administrative and assistant staff, spouses, families, friends, it's a very long list, partners, sponsors, and significant others who have been there for you and to support you through the course, and we sincerely appreciate that. All of you made our work very easy as a university to actually reach this point. Before we proceed to the formalities and you dash off to your lives and celebrations, allow me to share with you a few thoughts on the University of Pretoria and especially the Faculty of Health Sciences and the School of Medicine. And as a higher education institution of choice on the African continent, this university, this great university, the University of Pretoria, provide first-class undergraduate and postgraduate training and produce socially impactful research to find solutions for the world's most pressing issues. We achieve this through high-impact quality teaching and innovative research. Developing people, creating knowledge, and making a difference locally and globally are the key goals of our strategic plan and further initiatives as part of the vision of this university. The Faculty of Health Sciences is home to approximately 5,500 undergraduate and 1,500 postgraduate students, including medical and dental fellows in more than 40 disciplines. And students receive world-class teaching and training from 600 academic staff members located in 4 schools: dentistry, health sciences, healthcare sciences, health systems, and public health and medicine. The training of doctors and other health professionals to meet the healthcare needs of our country takes place in partnership with the Gauteng Health Department in its various training platforms and communities. So we also recognize their contribution and partnership here today and thank them for this partnership. It is not an easy one, but it works for all of us. I wish to thank the Department of Health for that. Top scientists and the faculty staff are committed to seeing these grassroots needs and to teaching the next generation of medical professionals. This is most commendable, especially when the lure of private practice and international opportunities for these top scientists is so strong. They deserve every honor for their selfless commitment to the health care needs of this country, because otherwise they would be elsewhere. Could you applaud them, please? The excellence in teaching, learning, and student support is evidenced by the faculty's throughput rates. More than 95% of students who enroll in the faculty complete their degrees. I'd like to repeat that. More than 95% of the students who enroll in the faculty complete their degrees. And throughputs are a very serious challenge in the higher education sector in this country. And most of these complete within the minimum time. And in addition, the faculty's research focus has diversified its research output, and support systems have grown over time. And of course, this faculty plays a role in various health professions, and a sizable number of our staff serve on various national and international and professional bodies across the world. Now, the medical school is finding appropriate solutions for medical problems for the African continent and elsewhere. And great strides have been made to enable care and the management of complex disease closer to our communities. And exciting new advances have been made over the past few months. The latest and much publicized is perhaps the world's first middle ear transplant using 3D printed bones. This pioneering surgical procedure was conducted by a team of specialists under the supervision of Professor Mashudu Shifularo, who I have known, Professor Rantluan will know, as a young specialist more than 20 years ago in ENT. And elsewhere in the school, we're at the forefront of the development of better regulatory practice and stronger guidelines for human genetics in South Africa. And of course, Professor Michael Pepper is a leading scientist that is addressing human genetics challenges that we're facing. And as rapid advances are being made in genetics and genomics technology, it is important that research, healthcare provision, and forensic applications are ethically and legally sound, culturally appropriate, feasible, and feasible and sustainable. Ladies and gentlemen, we all know that diabetes is one of the key issues in this country, an illness that really, a condition rather, that is the second biggest killer in South Africa, the second only to tuberculosis. And on the African continent, more people die of diabetes and diabetes complications than of malaria, HIV, and TB combined. And through collaborative projects, the School of Medicine plays a key role in bringing quality diabetes treatment to underserved local communities and overcoming the obstacles that exist in this regard, including, of course, the resource constraints, lack of trained healthcare practitioners, and patient-led factors. In neuroendocrinology, the director of our center, Prof. Bob Miller, recently received the World Academy of Science Prize in Medical Sciences for his fundamental and translational contributions in the field of neuroendocrinology, leading to the development of new treatment therapies for hormone-dependent diseases such as various cancers, endometriosis, polycystic ovarian syndrome, and so forth. The academics in the faculty demonstrate a commitment to lifelong learning and outstanding pioneering contributions in various fields, serving the pursuit of medicine as a career with distinction. And one such leader here is Professor Jani Hijo of our Family Medicine Department, who have had many, many years of associations with his work in Winterveld and other underserved communities. In a recent lecture series, the Dean of the Faculty, Professor Tiandi Jachar, pointed out how health, well-being, and sustainable development are intrinsically connected. In light of this, the focus of our efforts should be on vulnerable populations who are often the hardest hit by these epidemics. There is a dire need for reducing the morbidity and mortality from the non-communicable diseases, promoting mental health, preventing newborn and child mortality, reducing death and illness from hazardous chemicals in water, soil, and air pollution. From these examples, and there are many, I just selected these few, and there are many because we have very outstanding faculty members. It is clear that what we do today determines the future of the world we live in. And I'm confident that all of you as graduates who are present here today and those that are graduating in absentia will continue to transform the lives of a multitude of people in various ways. And in conclusion, dear graduates, in December 2018, you participated in the MBC Hippocratic Oath-taking ceremony, pledging to uphold the values of your profession, ethical conduct, and service to the community as practicing professionals. It is your responsibility to make that happen. As you know, we see many cases of unethical behavior by health professionals, and I sincerely hope that our graduates from the University of Pretoria don't form part of that unethical practices to the population. And again, it is my sincere hope to you as graduates that your qualifications will continue to empower you and make you play a constructive role in the world, open the doors for you, but also your families and the societies that you serve. And I wish that you will rise out above the rest in your fields of specialization, but also in your various roles as well-rounded individuals. Be proud role models, worthy ambassadors of Turkeys, and never forget where you come from, and donate generously for a worthy cause. What I'm saying is, when you start making money, remember the University of Pretoria. We would like to have some of that to assist those that you leave behind, and you know, you have encountered those hardships yourselves, and some of you have been helped by the generosity of the professionals out there. All that remains is for me to wish you well as you start your new chapter in your lives, and all the best. As we say at UP, make today matter. Tomorrow will be today, and so on and so forth. But whatever it is, make it matter. And I thank you.
Mr. Vice Principal, the supervisors will now introduce the doctoral candidates. Yeah. Thank you. Thank you.
Mr. Vice Principal, I introduce to you Sandra Aubrey, who has complied with the requirements for the degree of philosophy with a thesis titled An In Vivo and Ex Vivo Investigation of the Effects of the Heavy Metals, Mercury and Cadmium, alone and in combination on the cardiovascular system, prepared under my supervision and with Professor Nanette Oberholzer as co-supervisor. In her thesis, the promovenda investigated the effects of long-term exposure to the relevant dosages of cadmium and mercury alone and in combination on the cardiovascular system of Sprague-Dawley rats. The blood levels of each metal alone and in combination was raised, while markers of tissue damage were generally unchanged. In contrast, in the cardiovascular system, mitochondrial damage and increased lipid deposition in the myocardium were observed. In both the myocardium and the aorta, connective tissue fiber structure and distribution were altered, while in addition, mercury contributed to neointimal plaque formation. Blood hemostasis was also affected. Premature cardiovascular aging and a prothrombotic blood phenotype were identified that may increase the risk for associated disease in exposed populations. Mr. Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Vice Principal, I introduce to you Yenga John Bolokoatu, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Genotypic Diversity of Intrahemorrhagic Escherichia coli 015787, Isolates from Clinical Specimens and Environmental Samples in Gauteng Region, South Africa, prepared under my supervision and with Prof. M.M. Kok as co-supervisor. In his thesis, the promovendus used phenotypic and genotypic methods to determine the antibiotic resistance, virulence, and genetic relatedness of E. coli 015787. Shiga toxins were detected in the majority of isolates, which contributes to the pathogenicity of the bacterium. The 3 high-risk clones identified are known to be associated with food and waterborne outbreaks. This research forms part of an One Health approach, and the findings generated provided valuable information, highlighting the potential public health risk to consumers of untreated water, as well as humans who come in close contact with known animal reservoirs. Mr. Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Vice Principal, I introduce to you Nicolette Marie Duplessis, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled An Evaluation of Factors Associated with Early Infant HIV Acquisition, Infant Outcomes, and 9 to 12-month infant HIV seroreversion in the context of PMTCT option B+. Prospective data from an HIV-exposed birth cohort. Prepared under my supervision and with Professors Amina Goga and Tiens Avanon as co-supervisors. In her thesis, the promovenda evaluated factors associated with infant HIV acquisition, outcomes of HIV-exposed uninfected infants, and the 9-month seroreversion rate. A detectable maternal HIV viral load, maternal combined antiretroviral therapy for less than 1 month, and a symptomatic newborn are significant predictors of HIV acquisition. Risk models were developed, and she found that using targeted testing 24% of infections will be missed compared to universal testing. And this, therefore, supports universal birth PCR testing. The longitudinal growth of HIV-exposed uninfected infants illustrates lower weight for age and length for age trends, more so in males than in females. The impact of final height and body mass index with increased obesity also needs to be considered. The candidate described 9-month seroreversion in HIV-exposed but uninfected infants and observed that specificity of rapid assays ranges between 45 and 97%. With the possibility of delayed seroreversion, future recommendations should include PCR testing up to 24 months. Mr. Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Vice Principal, I introduce to you Jenny Deploy, who has complied with the requirements for the degree Doctor of Philosophy with a thesis entitled A Morphological and Physiological Analysis of Red Blood Cells in Relation to Serum Ferritin in Patients Suffering from Hereditary Type 1 HFE-Associated Hemochromatosis, prepared under the supervision of Prof. Risha Pretorius and myself as co-supervisor. In a thesis, the provender studied the red blood cells of patients with hemochromatosis. She used hematological testing, flow cytometry, and various ultrastructural techniques to study the presence of eruptosis in the main genotypic variation of HFE. She demonstrated significant changes in the membrane biochemistry indicated by the presence of phosphoridylserine proteins on the outer leaflet of the membrane. She developed a novel technique to visually identify eruptosis using fluorescence. She confirmed these results with microscopy, where the presence of an altered red blood cell morphology was seen in patients with high and normal serum ferritin levels. Her findings concluded that red blood cell pathology is present in all the studied HFE mutations, even in low penetrance mutations, warranting further investigation relating to the clinical implications of these findings. Mr. Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Vice Principal, I introduce to you Ahmed Hiri Mazandarani, who has complied with the requirements for the degree of Doctor of Philosophy with a thesis entitled Evaluating the Performance of HIV Testing in Infants Exposed to Antiretroviral Prophylaxis within South Africa's Prevention of Mother-to-Child Transmission Program, prepared under my supervision and with Professor Mike Pepper as co-supervisor. Every year in South Africa, 270,000 infants are born at risk of acquiring HIV infection and require HIV tests because early initiation of ARV treatment in infected infants is known to prevent morbidity and mortality. Dr. Hiri Mazandarani's research demonstrated that the increase in maternal antiretroviral drugs used to prevent mother-to-child transmission result in HIV-infected infants being born with lower and sometimes absent viral loads. The outcome is a high volume of indeterminate HIV test results, leading to delayed diagnosis of HIV in approximately 3,000 infants per annum. He formulated two options for reducing the number of indeterminate results. These informed World Health Organization recommendations to ensure that HIV-infected infants initiate treatment rapidly and that HIV-uninfected infants do not initiate unnecessary lifelong treatment. His work culminated in 6 peer-reviewed publications. Mr. Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree, Doctor of Philosophy with all its associated rights and privileges, on the candidate.
Mr. Vice Principal, I introduce to you Nina Hannibal, who has complied with the requirements for the degree of philosophy with the thesis entitled Understanding the Role of Maps in Community-Oriented Primary Care, a case study of map making in ward-based outreach teams in Mamelodi. The provender examined the use and value of maps and map making for community-based healthcare delivery. Working with the City of Tshwane, University of Pretoria Department of Family Medicine's Community-Oriented Primary Care Program in Mamelodi, she designed 3 participatory map and map-making projects to address healthcare workers and professionals' understanding of the practice and use of medical data and other maps. Through the local institutional support assessment, the history of health, and the community health map using contemporary data, she uncovered the different uses of maps for community-oriented primary care and how the process transformed the meaning and use for the people who use them. Although qualitative in nature and site-specific, the study's key findings will be applied to support healthcare delivery practice more generally. Mr. Vice Principal, I request you to award the candidate the degree.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Vice Principal, I introduce to you Michelle Janse van Rensburg, who has complied with the requirements for the degree of philosophy with the thesis entitled An Evaluation of the National Certificate Vocational Primary Health Qualification for Community Health Workers in South Africa. The promovenda evaluated a curriculated education program for community health workers. She used a pragmatic approach to the evaluation to determine whether the qualification provided adequate, appropriate, effective, and relevant training for community health workers in primary health care teams in South Africa. The study found that the community health worker education programs ought to be given priority in health system reform. Curricula should be based on the community-oriented primary care approach and should consider the capabilities of community health workers in context. There is a need for novel partnerships and interprofessional contributions to enhance education and to produce well-rounded, competent community health workers. The structure of programs should be in line with a national qualifications framework to facilitate career progression and pathways of development. The NCV primary healthcare program is in line with the recent WHO policy recommendations to support and optimize community health worker programs across the world. Mr. Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Vice Principal, I introduce to you Leanda Coffey, who has complied with the requirements for the degree Doctor of Philosophy with the thesis entitled Optimization of Histocompatibility Testing in Living Donor Renal Transplantation, prepared under my supervision and with Prof. Karosite as co-supervisor. In her thesis, the Provenda endeavored to optimize donor-recipient compatibility in renal transplantation in the shortest possible time. The study addressed the development and evaluation of novel procedures for the rapid, reproducible, and efficient measurement of T-cell alloreactivity, both pre- and post-transplantation. Furthermore, 3 cross-match procedures for the detection of cytotoxic antibodies were evaluated. She demonstrated that, of all the 3 methods assessed, donor-specific antigen cross-matching is the most efficient at identifying anti-human leukocyte antibodies in pre-sensitized kidney transplant patients. Cytokine analysis indicated that the involvement of eosinophil-mediated cytokines and increased anti-inflammatory cytokines may possibly contribute to the graft rejection. Finally, she comprehensively demonstrated that the use of the novel carbofluorescent succinimidal ester-based 2-way mixed lymphocyte culture may predict patients at risk of transplant rejection before transplant and can serve as indicator of possible graft versus host occurrences. Mr. Vice Principal, I request you confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Vice Principal, I introduce to you Lanelle Maria, who has complied with the requirements for the degree Doctor of Philosophy, with a thesis prepared under my supervision and with Dr. Junaid Hassim as co-supervisor. In a study titled Perspectives of Primary Caregivers on the Disruptive Behavior of Children Who Attend at Outpatients at Westkop Psychiatric Hospital, she utilized the qualitative methods of typological coding and bracketed grounded theory. Both analytic methods yielded findings that may help mental health practitioners to anticipate caregivers' understanding of the behavior and guide them accordingly. The findings suggest that caregivers require therapeutic guidance, specifically to deal with confusion and emotional turmoil elicited by the behavior of the children, the usual emotional build-up within the child towards a meltdown, a child demanding to have his or her way, the behavior of others towards the child, and the losses, rejections, and trauma that the child had suffered. A strong yearning and hope for a better future for their children, as found in this study, may serve as potential therapeutic thrust to deal with the challenges of disruptive behavior. Mr. Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Vice Principal, I introduce to you Dr. Simnikingwe Mayapi, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled Detection and Characterization of Primary, that is Acute and Early HIV-1 Infections in an HIV Hyperendemic Area. This was prepared under my supervision and with Professor Thomas Quinn as co-supervisor. In his thesis, the promovendus aimed to identify the window period during which HIV infections are missed at clinics using a highly sensitive laboratory-based molecular assay. He demonstrated the feasibility in detecting early and chronic HIV infections that were missed by rapid tests and showed a cost-effective strategy of detecting these infections in a resource-limited setting. The study provided an HIV intervention service as the individual identified with missed HIV infections were recalled to the clinics for appropriate management. Transmitted HIV drug-resistant strains were observed among the individuals with early HIV infection. The promovendus also observed mother-to-child transmission of HIV among participants who were initially misdiagnosed at the antenatal clinics, and he has successfully evaluated the field performance of a more sensitive rapid test, which could be considered for use at the clinics. Mr. Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Vice Principal, I introduce to you the promovenda Alison Riedel, who complies to the degree Doctor of Philosophy. In the thesis titled An Automated Computer-Assisted Approximation of the Nose in South Africans from Cone Beam Computed Tomography Scans, the promovenda created an accurate
3D computer-assisted method for the prediction of the nasal soft tissue shape based on the shape of the underlying skull substrate. She provided a validation of the precision of the automatic placement of landmarks and demonstrated its utilization as a convenient prerequisite for geometric morphometric-based shape analysis of the nasal complex. She studied the influence of factors, ancestry, sex, aging, and allometry on the variability of the mid-facial skeleton among 2 South African population groups, demonstrating their importance in the process of approximating the nose. She provided accurate statistical models which were optimized by including ancestry, sex, and age, highlighting the need for population-specific, accurate, and reliable 3D statistical nose prediction methods. This innovative method has implications for the reconstruction of other facial features and the complete face. Mr. Vice-Chancellor, I request you to confer the degree onto the candidate.
I hereby confer the degree Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Vice Principal, I introduce to you Susara Johanna Silberbauer, we know her as Sari Oosthuizen, who has complied for the requirements for the degree Doctor in Philosophy. She did that under the supervision of Professor Bob Pattinson. In her thesis, Respectful Treatment of Women in Midwife Obstetric Units, an interventional study to improve clinical care in Tshwane District, South Africa, the promovenda studied ways of identifying, implementing, and evaluating interventions to reduce the mistreatment of women and promote respectful, high-quality maternity care in midwife obstetric units. An innovation called Clever was developed from baseline measurements of health system building blocks and insights from cognitive neuroscience and psychology. Activities targeted the improvement of perinatal health outcomes and women's experience of care during childbirth. Working Clever led to significant improvement in women's perceptions and experience of care received during childbirth, and significant reduction in the in-facility fresh stillbirths, meconium aspiration, and birth asphyxia. Funding has been secured for further testing the Clever package across provinces in South Africa. The package also has potential for implementation in other low and middle income countries. Mr. Vice Principal, I request you to confer the degree on the candidate. Thank you.
I hereby confer the degree Doctor of Philosophy with all the associated rights and privileges on the candidate.
Mr. Vice-Chancellor, I introduce to you Ira Saidu Yahaya, who has complied with the requirements for the degree Doctor of Philosophy with a thesis titled The Effect of 3 Ghanaian Plants on Fibroblast Migration, Inflammation and Bacterial Growth in Vitro, prepared under my supervision and with Dr. Vanna Cordier as co-supervisor. The promovendus investigated the wound healing activities of 3 plants used in Ghanaian ethnomedicine for wound management. The study focused on the effect of ethnomedicinal and sequential extracts of the plants on acellular and intracellular oxidation states, cellular migration, in vitro inflammation, and bacterial growth. Ultra-performance liquid chromatography was used in tandem with mass spectrometry to tentatively determine the presence of phytochemically active components. It was demonstrated that the 3 plants assist wound healing at different stages in the healing process. The latter is achieved through their antioxidant effects, ability to suppress oxidative stress, antibacterial activity, and ability to enhance activity of fibroblasts and myoblasts. The study has thus highlighted the scientific basis behind the indigenously used medicinal plants contributing to the knowledge base in this area. Various sections of the project have been presented at both national and international conferences with 4 peer-reviewed journal articles that emanated from this research. Mr. Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree, Doctor of Philosophy with all its associated rights and privileges on the candidate.
Mr. Vice Principal, I introduce to you Elsie Nolter, who's complied with the requirements for the degree Doctor of Philosophy with the title Pro-Apoptotic and Radiosensitizing Potential of 4 Candidate Microtubule Regulators in Breast Cancer Cells, prepared under my supervision with Prof. Anita Baer, Prof. Laurence Lafanisher, and Prof. Roy Laker as co-supervisors. In this degree, the first degree registered between the University of Pretoria and the University of the Grenoble Alps in France, the promovenda evaluated the potential of a novel 2-methoxyestradiol analog and a limb kinase inhibitor to increase the sensitivity of breast cancer cells to radiation. This combination increased the production of reactive oxygen species, mitochondrial membrane permeability, and caspase-3 activity. AKT and FOXO survival protein levels decreased, thereby augmenting the apoptotic death. The combination treatment augmented the radiation-induced DNA damage demonstrated by the increased number of micronuclei. Delayed activation of the damage and repair proteins, gamma H2AX and Q70, were observed. The limb kinase inhibitor increased ROS production and mitochondrial membrane permeability in cells exposed to fractionated radiation therapy, illustrating a retardation in the development of radiation resistance. This research contributes to the understanding of molecular mechanisms involved in the radiosensitizing effect of mitotic drugs in the continuing bid to develop effective cancer treatment regimes. Mr. Vice Principal, I request you to confer the degree on the candidate.
I hereby confer the degree, Doctor of Philosophy, with all its associated rights and privileges on the candidate.
Mr. Vice Principal, the following candidates have complied with all the requirements for the degree Master of Medicine. Can I have that as well? In dermatology, Kim Ensley. In dermatology, Jacob Starin, she obtains the degree with distinction. In dermatology, Bunolo Mushiana. In dermatology, Rangwezi Olivia. In family medicine, Buzangu Ilunga. In internal medicine, Maringa Charles. In internal medicine, Mateja Majadiji. In internal medicine, Matibedi Jethro. In internal medicine, Ndlovu Nomagugu. In nuclear medicine, Reineke Floret. In obstetrics and gynecology, Mautu Kalansu. In obstetrics and gynecology, Ndaba Sanele. In otorhinolaryngology, Ramahaha Serwalo. In otorhinolaryngology, Tayeb Kiri Ahmed. In orthopedics, Davis Graham. In orthopedics, Vanemerve Vian. In pediatrics, Chauke Makamba Bonisiwe. In pediatrics, Matwin Adele. In pediatrics, Pitso Buitumelo. In pediatrics, Tlaka Zanele. In hematology, Matlako Khopa Tebogo. Candidates for M.Med Medical Pharmacology, Jairam Narendra. Master of Medicine in Psychiatry, Drea Justine, she obtains the degree with distinction. In Psychiatry, Nechilema Chichikawe. Master of Medicine in Surgery, Ngwenya Rulani. Mr. Vice Principal, the following candidates have complied with all the requirements for the degree Master of Science. In Anatomy, Kuonech Anya, she received the degree with distinction. In Anatomy, Kruger Melinda. In Human Physiology, De Villiers Soulet. MSc Human Physiology, Otto Monique. In Human Physiology, Pesedenot Ioannis. In Human Physiology, Ferreira Mornay. MSc Human Physiology, Janse van Nieuwenhuizen Johan, he received the degree with distinction. MSc Human Physiology, Jobela Babalwa. MSc Human Physiology, Meyer Peter. MSc Human Physiology, Nunes Goncalves Julian, the degree is awarded with distinction. MSc Human Physiology, Pasha Marianne. MSc Human Physiology, Ramushai Teboho, the degree is awarded with distinction. MSc Human Physiology, Van Heerden Bernadette, the degree is awarded with distinction. MSc in Medical Immunology, Adam Ladislaus. Master of Science in Medical Microbiology, Duba Tabang. MSc Medical Microbiology, Kukemur Chantal. MSc Medical Microbiology, Mohale Remuratile. Thank you. Master of Science in Pharmacology, MSc Pharmacology, Maluleke Inos. In Pharmacology, Mkize Bongimpilo. In Pharmacology, Sensom Bianca. MSc in Reproductive Biology, Gouveia Chantel, the degree is awarded with distinction. In Sports Medicine, Besta Marias, the degree is awarded with distinction. Sports Science, Sutcliffe Duncan. In Sports Science, Buota Caroline Marie, the degree is awarded with distinction. Biokinetics, Dutoit Francois, degree awarded with distinction. Master of Early Childhood Intervention, Batev Daniela. Contact Natasha Lee. Ditlerk Trohandi. De Villiers Courtney. Gina Simona. Ferguson Daniela. Gopisharan Avashni. Graham Nicole. Hanekom Natalie. Mkombo Ntando Yenkosi. Mupatlani Dineo. Naidu Yeshoda. Olivier Anshen. Pepperell Kaylee. Ramudisa Ntabisi. September Deslin. Van Niekerk Malien. Vayech Sumeya. Wright Rishenda. Zimmerman Nicole. Mr. Vice Principal, the following candidates have complied with all the requirements for award of the postgraduate diploma. In general ultrasound, Kele Lena. Mr. Vice Principal, the following candidates have complied with all the requirements for the degree Bachelor of Medicine and Surgery. Abdullah Yumna, the degree with distinction. Abraham Ria, degree with distinction, and she also obtains the LT Tehrun Medal for the best student in obstetrics and gynecology. Adams Marcel. Ahmad Mohamed Umar. Okay. Anderson Kate. Arnaud Cordell. Apples Olivia. Arumugam Tiara, she obtains the degree with distinction. Aziz Yasira. Barnard Chantel, she obtains the degree with distinction. Bata Siposihle. Bates Nicholas. Bedesi Kiresh. Blichnaut Nadine. Blomeres Emilia. Boyer Lisa Marie obtains the degree with distinction. Bonafide Floris. Bowman Geraldine, degree with distinction. Bonman Willett. Brand Bianca. Briette Marco. Briggs Sarah. Bronkhorst Mike. Brooks Anna. Kasim Firdaus. Cele Mukelani. Shabalala Shaisani. Chapman Brittany, degree with distinction. Classens Isabella. Kutie Anin, she obtains a degree with distinction and the Family Medicine Prize for the best MBCHB student in a rural district. Cronier Natasha. Dada Celiwe. Davis Taylor. Dibier Eloise, degree with distinction. De Freitas Kiera. Dier Mendla Emilia. Diager Suzel. Decker Henri obtains the degree with distinction and receives the Sussex Prize for the best student in community obstetrics. DeForce Ruald obtains degree with distinction. Dilu Muhammad. Durga Priya. Duba Adonis Sinaye. Duplessis Melissa. Dutoy Damien. H. Camp Hannah, degree with distinction. Enslin Dimitra, degree with distinction. She also receives the Nestle Prize for the best student in pediatrics at 6th year level. Erasmus Johan. Fick Simoni obtains the degree with distinction and the Psychiatry Prize for the best student in psychiatry and the SASOG North Gauteng Prize for excellence in obstetrics and gynecology. Firefort Alexa May obtains the degree with distinction. Fori Jacques. Fraya Jessica, degree with distinction. Fraya Jessica Ashley. Gani Mubin, degree with distinction. Gibson Richard. Gina Sipiwe. Golshach David. Grabe Eduard. Grabe Melissa. Grief Clarindi, degree with distinction. Gokul Shahir. Haripasat Siluna. Henderson Sean. Henry K, degree with distinction, and she also receives the South African Academy for Family Medicine Primary Care Prize for the best student in family medicine. Heymans Samantha. Heinz Melissa. Shangoti Louis. Hweyane Palesa. Hoffman Helena. Hosfall Fiona. Dwe Tezin. Hugo Carl Adrian. Hugo Nadine, degree with distinction. Jansen Enlio. Jansen Charissa. Jansen van Rensbeek Eileen. Jansen van Vuren Lucas. Jansen van Rensbeek Brendan. Jansen van Rensbeek Michelle, degree with distinction. Jansen van Rensbeek Thomas obtains a degree with distinction and also receives the SASOP Award for the best MBCHB final year student in psychiatry. Jitansif Divayoti. Jessamine Samantha, degree with distinction. Jivan Misha. Young Kaylee. Jones Matthew, degree with distinction. Yep. Jusap Wasim. Yube Alida, degree with distinction. Yube Andri, degree with distinction. Yube Gideon. Juta Parisha, degree with distinction. Kamuzinzi Humphrey. Karodia Lukman. Kwedi Sompo. Kotabuchas Bibi. Kosa Bukosi. Koza Lunga. Kim Da. Knudsen Zanei. Kruger Anamart, degree with distinction. Kruger Shanae, degree with distinction. Kruger Mashudu, degree with distinction. Kisel Petra, degree with distinction. Lamont Renee. Lange Megan. Lekranze Danita, degree with distinction. Leroux Judith, degree with distinction. Lin Kwai Wen. Lisana Zandile. Livanos Michel. Watch the camera. Logan Joanna. Lombard Maricia. Lombard Olga, she obtains the degree with distinction and the South African Academy for Family Medicine Primary Care Prize for the best student in family medicine. Lothar Yako. Lothar Louisa, degree Makina Tarolwa. Makoka Koni. Malati Lea. Malifu Matapel. Malobola Pumzile, degree with distinction. Mamicha Tsepo. Manga Devaksha, degree with distinction. Marema Munaka. Maretz Tienes. Marshall Kayla. Martens Madeline. Max Michel. Mashanye Anthony. Mashilela Tsedisego. Masiti Mabutu. Matiba Marang. Matsuso Retabile. Thank you, thank you. Mbeli Tosca obtains the degree with distinction, and she also receives the Sasok North Gauteng Prize for Excellence in Obstetrics and Gynecology. Mboto Slindile, degree with distinction. McDonald Niels, degree with distinction. McGrath Christine, degree with distinction. McGregor Ahen Shannon. McLary Dean, degree with distinction. Mdluli Bafana. Mdletshe Sithembile. Melanie Sakhe. Mayor Johan. Mayor Lise. Mitchell Peter. Mitchell Travis. Mieni Bongani Theophilus. Mobi Piello. Mohamed Ozeir. Mohan Sashan, degree with distinction. Mukai Tumelo. Mukuku Piti. Mukwena Horoshi. Muloisi Matume. Thank you. Muelman Ilse, degree with distinction. Mokoth Urmila. Murena Tato. Murupa Lesijo. Mushidi Minki. Mucholopani Dintle. Mutata Pachani. Mutabedi Halaletsa. Thank you. Thank you. Moulton Danielle, she obtains the degree with distinction and also receives the South African Academy for Family Medicine Primary Care Prize for the best student in family medicine. Mouton Vicken. Mpuleleng re amogetse. Msibi Tobile. Msimango Makenze. Thank you. Thank you. Thank you. Thank you. Thank you. Mudogwa Mashau. Thank you. Mukadam Aliyah, she obtains the degree with distinction and the South African Society of Anesthesiology Prize for the best final year student in anesthesiology and the Department of Surgery Prize for the best student in the final year of surgery, clinical. Mula Yusuf. Munyai Awelani. Mutafia James. Ndove Joan. Nel Imke. Nel Janine. Nembudani Masindi. Ngema Zandile. Okay. Ngamwa Tucheni. Ngoweni Nkensani. Nivote Tamila. Nokele Atipila. Nope Elne, degree with distinction. Uba Olsa Elizabeth, degree with distinction. Wedendal Gitte. O Sauk. Hotel Tiffany degree with distinction. Osborne Stephanie. Osuk Stanislav, degree with distinction. Parayachi Mikeshni, degree with distinction. Paige Megan. Parker Lloyd, degree with distinction. Phala Lehlohonolo. Pinar Jean. Pillay Vishnu, degree with distinction. Poch Kelsey, degree with distinction. Patrick Mel, degree with distinction. Victoria Chantel, degree with distinction. Pretorius Henning. Prowling Megan. Pule Mapule. Rabi Evan, degree with distinction. Ramambila Sida. Rampavana Tiatu. Ramsarup Ahesh. Reitzma Olivia. Rickert Cariana. Ru Tamara. Roy Jose. Rest George. Samuel Sten. Skeppers Waldo, he obtains the degree with distinction and the School of Medicine Prize for the best student in the final year of study, and the Pediatrics Alumni Prize for the best student in pediatrics during the 5th and 6th year of study, and the Internal Medicine Prize for the best student in internal medicine, and the Department of Surgery Prize for the best student in general surgery. Nadia Schoenfeld. Guido Schroeder. Schultz Dave. Surudi Lisette. Semuga Jane.
Squani.
Swane Sibahle. Shams Cheyenne, degree with distinction. Sherinda Tinyiko. Shisinga Shongile. Sifanele Lihle. Sing Damini. Sithole Matapelo. Skinner Garth. Snyder's Anna. Stein Juandi. Sugdio Diana. Swanepoel Andre, degree with distinction. Swart Natasha, degree with distinction. Talma Yana, degree with distinction. Taylor Memory Ryan, degree with distinction. Teketa Oha. Tyrion Anya. Tribel Alexander. Sotetsi Ayanda. Twycross Nicholas. Urio Sia. Van Merwe Oliverine, degree with distinction. Van Vechte Andrea, degree with distinction. Van der Wald Alexa. Van der Westhuizen Stefanus, degree with distinction. Van Heerden Zanda. Van Niekerk Anida. Van Niekerk Jan obtains the degree with distinction and the Excellence in Clinical Pediatrics Prize for the student who obtained the highest marks for clinical component of the final examination in pediatrics. Thank you. Van Rooyen Kala. Sorry, Carita. Apologies. Van Toner Alicia. Van Vuren Vincent. Van Veek Sunei. Vierendal Janin. Veljoen Regina. Van Stichting Hanko. Weideman Luhan. Williams Kalin. Yimbo Marilyn obtains the degree with distinction. Zieman Jakob. Zimkendorf Andreas. Don't leave it. He also obtains the summer, the summer John Struthers Award for the student who made the largest contribution to the student community. Zituta Lutando. Zulu Zamazulu.
Can we give them a big hand again? Ladies and gentlemen, as you have observed, we had a power failure momentarily, and the generator took a bit longer to kickstart, and we do apologize for that. These are the days that we should be getting used to as South Africans of power outages. We have now come to the end of the proceedings, and before we close, I wish to invite all of us here present to refreshments afterwards. There would be a marquee out here of the hall, Rembrandt, just tea and probably snacks. And now you are requested to stand and remain standing for us to sing the national anthem, and after which we'll dissolve the congregation. By the authority entrusted to me, I hereby dissolve this assembly of the University of Pretoria. Thank you.
Post you